Hi, I'm Mayor Will O'Neill of the City of Newport Beach, and I'm joined by former two-time mayor and my current colleague, Diane Dixon.
Good day. I'm Diane Dixon, council member, Newport Beach, and I'm delighted to be here with our Hoag experts, and thank you for helping us put all this together, so thank you.
That's right. So with us today are Dr. Michael Brant-Zawadski, affectionately known as Dr. BZ, and Dr. Martin Fee. Dr. Brant-Zawadski is the senior physician executive at Hoag Hospital. His focus is to integrate specialized services with population health. He helps Hoag transform healthcare strategy by focusing on specific health conditions using a program-driven, physician-led, multidisciplinary team approach measured by patient-focused outcomes. He also oversees the Hoag Center for Research and Education. Thank you for being here.
Thank you for having us.
And also with us is Dr. Martin Fee, the Senior Vice President and Chief Clinical Officer at Hoag Hospital. Dr. Fee completed his internal medicine residency at the University of Chicago Medical Center and his infectious disease fellowship at USC LA County Medical Center. He has been a practicing infectious disease specialist at Hoag since 1994. Dr. Fee has served in several other leadership roles at Hoag, including Chair of Infection Control. Clearly, we are with the subject matter expert today, and we're delighted that you are joining us today. Thank you.
Thank you so much for having us.
So let's jump in and ask a question a lot of people have been asking, which is, since the county started releasing city statistics on confirmed cases, you've seen it bouncing all around for a number of cities. What do confirmed cases tell you about how a city is doing, and are there better metrics for us to be looking at?
Hoag is not just a Newport Beach asset, but we're very proud of having served the communities of Newport Beach, Huntington Beach, Irvine, Costa Mesa, and adjacent communities, Laguna Beach, Tustin, for now going on more than 6 decades. And because we are familiar with the numbers, that is a question that has come up. Why does Newport and Irvine and also Anaheim seem to have the highest numbers of confirmed infections? And Martin can chime in on this. My personal opinion is that since we saw the very first patient in Southern California, showed up on our doorstep at the hospital in Irvine, was immediately isolated because we knew what to look for with the great preparation by our head of infection control, Dr. Phil Robinson. We were all prepared for the possibility and treated that patient very well, being allowed to by the Orange County Health Agency. Our relatively affluent community means that our residents travel to resorts and skiing in February, et cetera, et cetera. So between the business and commercial aspects of travel into Newport and Irvine in particular, the spread of the virus had an easy entree. Anaheim, because of Disneyland, the same thing. A lot of folks, a lot of international folks. The very first death that occurred in Southern California was a woman who traveled to Los Angeles from Rome, Italy, which is one of the hot spots. The virus has been spreading in our community because of that unrestricted travel since probably December, and certainly into January and February.
Do you think that's supported by the fact that Newport Beach over the last 10 days or so has really declined in seeing the numbers rising quickly because the travel has essentially stopped over the last month?
Well, I think there are two things. On number one, the numbers that we're seeing as far as positive confirmed cases do not indicate the spread of the virus. They simply indicate disease that has been there in the community for 7 to 10 to 14 days and now is expressing itself as an illness. The reason I think that the numbers are now stabilizing and going down is that lag time. The illness has been here. It is now ebbing. And yes, the fact that people aren't traveling is stopping the spread to some degree, but also there's a natural life cycle to the virus's spread in a population that hasn't been exposed to it before, and then ebbing as immunity builds up against the virus in the general population and with the measures that we're taking, which is extremely disciplined self-hygiene, self-isolation when sick, even sheltering at home. And certainly the travel issues, restriction of travel have helped.
I think the fact that California did the sort of strict isolation and hygiene measures very early allowed us to sort of blunt the surge, if you will. I think New York, as an example, was somewhat caught by surprise, and also I think the fact that Orange County, Southern California in general, is got, it's much more suburban, wider open spaces, car culture. You look at some place like New York City where it's densely populated mass transit, and it really, in some place like New York City, it really exploded before they had a chance to even, get their arms around it. And I think in Orange County, all of California, but I think Orange County especially, that we've really adopted the recommendations to self-isolate, stop the gatherings, the 6 feet of social distancing, all those measures we adopted early and pretty aggressively. And I think because of that, it blunted a lot of the spread, even though we do have a large number of traveling, international travelers and those sort of things that Dr. Beasy talked about. So.
Do you think we are flattening? Has the curve
Definitely
started
in
to
Orange
flatten?
County it has. Yeah, I think you can. I mean, anyone can go online and see those statistics.
Yeah.
If you haven't, I might say that for people to go. The Orange County Healthcare Authority has a great website with daily COVID statistics
Right.
and stuff like
I
that.
see
So
that.
if you're, since there's no baseball, if you want to get your statistics fix, go on to OCHCA website for the COVID stats every day. But you'll see it's flattening. The number of new cases, and which is good news, right? And even at Hoag Hospital, our own anecdotal experience at Hoag, our peak number of hospitalized patients was about 2 weeks ago at 25. Today we're pretty flat at 10, 9 to 10 over the past few days.
As Martin mentioned, from the peak of 24, 25 at our peak, which is about a week and a half ago, we're down to 10. We've had no new admissions as of today. So it's not that the curve is flattened. We're on the other side of the curve and heading down. Clearly, the measures that we've learned so well, the hand washing, self-isolation, if you even have a sniffle or a cold, a little sore throat, a little runny nose that you would normally not pay any attention to, from now on, whether it's COVID or the normal cold coronavirus or the flu, stay home. Don't get other people infected until you're over it. If you have to go out, wear the mask, which is the purpose there is to help you prevent from infecting others rather than protecting you. Masks in a highly dense infectious circumstance have to be surgical and maybe even more than that to prevent you from catching something. So the masks that we're now wearing are for us to prevent infecting others inadvertently, because some people, it's uncommon, but some people who have the virus asymptomatically can still spread it with close contact.
I've actually had people ask, should I still go to Hoag? Is Hoag safe for me to go to the hospital when I normally would have been going there? And I guess the follow-up to that is also, when do we think elective surgeries might start back up, especially if the capacity at the hospitals is pretty large at the moment?
So we were very happy to see a young couple, 2 lovebirds that came to us a couple of weeks ago. He was 90, she was 88. They had symptoms of COVID. They were high-risk people, needed some care, and admission occurred. And a few days ago, or actually longer than a few days ago, my time is collapsing. Last week, they went home back to the house they've been self-sufficient in for the last set of decades. And are going to be featured in the Orange County Register story. I say that, I give you that anecdote, not just to give testament to what a great job Phil Robinson and our entire care team, Grace Lazinski, our Chief Quality Officer, have done in enabling the care for these COVID patients like we do every day for all the other patients that we see. I give you that story to make a point about differentiating the individual risk, to your question, the individual risk of coming to the hospital versus the horrendous collective numbers we hear about, 25,000 deaths in the US, right? The collective numbers of infections, numbers of deaths are terrifying. But at the individual level, at the level of our young lovebirds, the risk of dying from COVID, we've learned this now, even though it spreads very quickly and very rapidly, the actual individual risk of dying from a COVID infection is less than 1%. It's on the same order of risk for an individual, even if you catch it. the risk of your dying from it is on the same order as dying in an accident.
Let's talk about the future. I know Hoag's been involved with some clinical trials.
Yes.
Is there going to be treatment? Is there a cure? Is there going to be a miracle vaccine, a miracle drug? So what's happening and when will it happen?
Well, it's all happening right now, and I wish I had a crystal ball to tell you. I will say that as BZ mentioned, the coronavirus again is a mutated cold virus, right? And so knowing that we haven't had a cure for the common cold yet, I'm not super optimistic that we'll have a quote unquote cure for COVID-19. Certainly there's a lot of work going on right now for a vaccine. So maybe we'll get one, maybe we'll be lucky and we'll have a vaccine for COVID-19, but I don't think we can count on that. In the meantime, there's ongoing clinical trials, and Hoag has been very fortunate that we've been able to participate in that. The couple that Dr. BZ mentioned got one of the new medications called remdesivir. I don't know if you've heard of it, but it's one that looks promising. It's not FDA approved yet because they're still doing the study, but they were part of that study. And so that's more for acutely ill patients. It's intravenously only, but that's one trial that we've been participating in at Hoag, and our patients have had access to receiving that medication. Anecdotally, they seem to do pretty well, but again, time will tell. You can't just base it on one site and one experience, but Hoag's experience with that medication has been pretty good. We also have convalescent plasma clinical trial. I don't know if you've heard of that, but where they actually take plasma or blood from patients who've had COVID, take the antibodies out of it, and then inject it into patients who have very severe COVID-19 infection to see if that'll work. That's had some efficacy in other diseases like Ebola and that sort of thing.
So I just want to tag on to that a little bit. I think it goes to the issue of when can life return to normal and what does that look like. And so 2 years ago, to Martin's point, there was a novel flu virus. It was a mutation. That year's vaccine only worked on 10% of the population. And we were overwhelmed. People forget, we were overwhelmed. Hospitals were overwhelmed with a very heavy flu season. People were standing outside of our ER door, whereas today it's crickets there. We didn't stop elective surgeries. We didn't do any of the things we're doing now. 80,000 people died in the United States 2 years ago. And if you Google it, that's a CDC statistic with 50 million people infected. And we carried on, other than the hospitals being slammed, and the unfortunate families and victims of that particular flu strain, we carried on. Part of why we reacted the way we did is kind of with that memory in mind, didn't want our healthcare systems to be overwhelmed. So there are two reasons to fight a virus like this. One is prevent needless death, and two is make sure that the hospital systems aren't overwhelmed. So we've learned something from that experience 2 years ago.
Well, and following up on that point, one of the things that Hoag has been really good about on their website and then in public messaging has been talking about whole community health, talking about the mental well-being of people. And there's plenty of studies out there showing that isolation for a long period of time has disastrous health results. And so I'm kind of curious. I will just say, in the city of Newport Beach, we've tried very, very hard to make sure open spaces are open so that people can get out as long as they're social distancing, staying close to their neighborhoods. We've been messaging that, but I'm curious from your perspective, when Hoag is talking about the whole health of the community, the mental well-being of the community, what are the resources that Hoag is employing right now to make sure they're taking care of that for the areas around us?
Well, that's a great question. And to your point, the busiest service we have in the hospital today is our addiction service and our mental health service. They're full. The phone lines are ringing more like we've ever seen. Our Aspire program, the program that we designed for after-school resiliency training for high school kids who have issues with anxiety and other mental health issues, it's full, and we have the longest waiting list we've ever had. Maybe it's because the parents want them out of the house. but the mental health aspects of this have yet to be studied. The fear virus and the level of anxiety generation, I heard on the way into work today, there was an interview with Here's what recovery from COVID looks like. And the person says, I'm recovered, but I have headaches and I'm feeling weak and my memory's a problem. And I'm thinking to myself, this person has post-traumatic stress disorder. They don't have side effects of recovering from COVID. I mean, it's a classic set of symptoms for PTSD. And so those issues are going to be with us, which is why I'm maybe excessively fixated on the fear virus as being a true health condition. That's a second virus that we have to deal with going forward.
Certainly there does seem to be that neurologic effect of anosmia, they call it, where you lose your sense of taste and smell or can. But I question whether a lot of these other things, fatigue, headaches, memory loss and stuff, are really COVID per se, or just like Dr. Beasy was saying, post-traumatic stress disorder, or just depression, right? After everything that's been going on, right? And I think I'm seeing that a lot of those symptoms in people who haven't had COVID, right? I feel that way sometimes. I mean, I think we all feel that way, don't we? I mean, you feel kind of disoriented. Yeah. You're like your whole world's turned upside down. So you feel kind of disoriented, like, am I in a dream or something like that? So I think you can't underestimate the mental health effects of this, as Dr. Beasy calls it, the fear virus, but just the mental health effects of this unnatural isolation that's not the way humans are wired, right? So.
Now, just a segue to follow up on that, tell me about Hoag's virtual care. Is that part of it?
Yeah, well, certainly, I mean, in other words, it's more around the fact that, and I like to say that just because COVID is here doesn't mean all other health issues have gone away. Healthcare has had a little challenge catching up with the technology in terms of regulations and things like that. So previously, televideo visits and things like that you can use, not for every medical condition, but for many follow-ups and simple things were never allowed because they didn't exist 20, 30 years ago. There was no, there was no, reimbursement. There was no, means to do it. And suddenly with COVID, it all melted away. And now we're able to provide medical care in the convenience of your home. And I think...
How does someone access that?
So all you do is call your doctor. It's as simple as that. Call your doctor. And like I said, at Hoag, any physician who's in a Hoag facility has it. And I would say even those doctors who are in private practice but are Hoag doctors, part of our medical staff, I think most of them have it. So call your doctor. Most of them now have, because all the barriers went away, right? And so most of them now have the ability to have an appointment. In fact, I do a lot of work at Hoag Medical Group as part of my role, and we're actively calling patients who canceled their appointments, right? People who canceled their appointments because of COVID, we're calling them up and saying, hey, would you like to reschedule that with a televideo visit so that your doctor can, take care of you? Now, certain things you still have to come in and see the doctor, and you should, right? You shouldn't sit home and have your heart attack, having chest pain at home, or go into the emergency room because you're afraid, not going to the emergency room because you're afraid of COVID. But I think certainly now, Hoag I can speak to personally, and I think most healthcare organizations now have that ability, and I would strongly encourage people to contact their physician's offices and to say, hey, I'd like to set up a telemedicine visit, because I just started doing it myself. I still practice infectious disease. I had office last Friday morning and had 10 patients scheduled, and 9 of them were televideo visits.
Now, is that initiated by the patient or the doctor? Because say, why don't we just do a televideo?
It's a little of both. So it's part of it is getting the word out, right? Because you're asking the question, well, this sounds new to me and I don't know. So we've been emailing patients, sending out flyers to say, hey, we got televideo visits. And then also I have my staff call the patients ahead of time to say, do you know we've got televideo visits available? Would you like that option, right? Because what will happen, what our experience has been with COVID so far, is that people will just not show up, right? They'll say, they'll have their appointment, and then they'll either cancel it last minute, because they'll think like, well, I want to see the doctor, but I don't know what's going to happen. And it's like, oh, it's still COVID, I'm not going, And so to be proactive, we've been reaching out and just saying, hey, we've got this available. We don't necessarily encourage it. If you want to come in, or you have, some lesion that you want me to look at or something, please come in. We can do it in a very safe manner with masks, everyone's masked and those sort of things, take everyone's temperatures and such. But, but at least we're being a little bit proactive to say, hey, we've got this available to you. We'd rather have this converted to a telemedicine televideo visit than have you cancel or no show and not get the care you need, right? So
That's very good to know.
Yeah.
So as mayor, I just want to say thank you so much to our doctors for helping us find the signal and the noise. We are inundated with information, and the ability to have two experts talk to us about how Hoag is helping the community is invaluable. So I just want to say thank you.
And I, too, thank you, Dr. Fee. Thank you,
very
Dr.
welcome.
BZ. It's been enlightening and educational for both of us, and I appreciate it. We should do this on a regular basis.
Well,
Yeah.
I was going to say, we share a partnership, which is public safety. We've done other things together before. I know I've worked with the city council on some other issues around public safety. And that's a shared commitment that we're partners in. And so we greatly appreciate you giving us this opportunity.
There's so much, not only with this virus, there's just so many aspects to Hoag that the community is unaware of in terms of modern medicine and the delivery of modern medicine, as you just described, Dr. Fee, and the telemedicine. And I think we should get you before the community in other ways as well. But this is a great forum to push this message out and how important Hoag is to the health of our community. And I want to thank you both for what you're doing for our community beyond just Newport Beach, your service area, as you described in Orange County. It's a fine service, and we're proud of your reputation, your national reputation. So thank you for all what you do for all of us to keep us healthy.
Thank you.
Thank you.
Thank you very much.
Thank you.
Thank you.